and hopefully renal, some of the renal for today, surgery and renal, okay, and then we'll do continue dermatology maybe tomorrow. Okay, so so let's start. Okay, so if you are a 84-year-old male who presented within 1 hour of back pain and you had syncope that lasted less than 1 minute, I check your blood pressure is 72/55, your pulse is 112. So when I do EKG, I found prominent horizontal ST segment depression in the anterior chest leads. So what's causing this back pain with syncope and hypotension and gross hematuria too? Hmm?
Aortic dissection?
Yeah, close. Yeah, it's aortic aneurysm rupture. Abdominal aortic aneurysm rupture.
Aneurysm. Oh, okay.
It can cause that. Okay, so if you are a 55-year-old male who have a chronic pain in your buttock, hip, and thigh muscles. Okay, when I examine you, I found decreased femoral, popliteal, dorsalis pedis pulses on both legs. So what do you think is going on in that guy? What else? What else? What other symptom do you expect?
So maybe this is a PAD, Leriche syndrome.
Yeah, excellent. So they have impotence too. They have high risk of impotence. Leriche syndrome. Good job. Yeah. Told you. You're ready. So this is aortoiliac occlusion. It's a bilateral. Yeah, it's a bilateral atherosclerosis. That's it. Okay. Now, if you are a 43-year-old male who has a schizoaffective disorder, so you tried to commit suicide by throwing yourself from the 3rd floor. Okay, so you came to the emergency room with a blood pressure 137/90, and when I did chest x-ray, I found a dilation of the mediastinal widening. So what do you think is going on in your situation here?
Do you think maybe aortic injury?
Yeah, excellent. It is aortic injury. That's how it presents. Present with enlarged, widened aortic arch, and this obscuring pulmonary artery. That's how. They can give you a picture, or they can give you a present. They can give you in words. Okay. Okay. So if you are a 23-year-old male who brought to the emergency room after a motor vehicle accident, I check your blood pressure is 80/40, heart rate is 120. Okay, you respond to strong vocal and tactile stimuli by opening your eye. Your pupils are equal and reactive to light. Your neck vein are distended. Okay, chest X-ray
neck vein, okay.
Yeah, chest X-ray shows small left-sided pleural effusion and normal cardiac contour. So what's going on here?
Okay, increased JVP, chest X-ray is left-sided what?
Pleural effusion.
Pleural effusion.
And I'll give you a very big clue too. It's gonna help you a lot. So I gave you IV fluid. You're still hypotensive. Now you gotta know the diagnosis. What's going on?
Oh, you gave IV fluid?
Yeah.
I'm thinking either pulmonary contusion or hematoras, one of them.
So these, I think they respond to hypertension. Most likely, especially when you have JVD, distension, and resistant to IV fluid, hypertension resistant to IV fluid. This is cardiac tamponade, pericardial tamponade.
Oh,
okay.
Cardiac tamponade, resistant to IV fluid?
Yeah, that's a big clue for
cardiac tamponade.
Pericardial tamponade, okay? Just keep that in mind.
Oh, okay, yeah.
Okay, so if you are a 64-year-old male who presented with an early diastolic decrescendo murmur at the left sternal border, your chest X-ray shows a widening of the superior mediastinum. Okay, so what do you think is going on here?
So widening mediastinum?
Yeah,
and
widening
what else?
of the superior mediastinum and early diastolic decrescendo murmur. So what could cause that?
Oh, so maybe the patient has an aortic regurgitation due to maybe aortic dissection, aortic root.
Yeah, but what causing that? So it's good job. You diagnosed it right. So that's an important. I'll give you a plus for that. It's an aortic dissection.
Okay, you said what is causing the murmur?
Yeah, it's most likely hypertension. So hypertension is a big risk factor for aortic dissection, and that aortic dissection present with causes. So when it dissected below, it goes to the aorta, causes aortic regurg. So it causes early diastolic murmur with widened mediastinum. When you have these two big clues, that's a dissection. Okay? Okay, I'll give you another one. If you are a 76-year-old male who presented, who had a catheterization due to an MI, and then after the catheterization you had a blood pressure of 75/60, plus a back pain and generalized weakness. So what do you think? What should I do right now?
So the patient is bleeding from somewhere, you know, after CAT, maybe like a hematoma somewhere. You want to do like a SLAP to go and see where the bleeding is coming from. You want to do like a laparotomy, you know, like exploration, right?
Yeah, it's you're right. Good job. However, before laparotomy, just do CT scan of the abdomen and pelvis without contrast. Okay.
Oh, really?
Yeah, because this is most likely, you're right, it's a retroperitoneal hematoma. When you insert a catheter inside your body, it's most likely going to puncture an artery somewhere and causes bleeding. So that's what I want you to be aware of. You do CT and then laparotomy. Okay. So now, if you are a 62-year-old male who on physical exam you found a second-degree burn covering both upper extremity and a third-degree burn over the anterior aspect of both lower extremity. Blood pressure is 90/60, pulse is 120, temperature is 35. When I check your labs, I found the white PC to be 16,000. So what do you think is going on here?
Because of the white blood cell going up, maybe infection.
Yeah, excellent.
From
excellent. This is
gram-negative rod. I think mostly Pseudomonas, right, or something like that. I don't know.
Yeah, it's a bacterial infection. Yeah. Okay. Yeah, you're right. Pseudomonas is most common with thing, but this is what I want you to be aware of. So when you have sepsis, the temperature could be more than 38, 101. Could be more than that, or it could be lower than that, less than 35, less than 95 Fahrenheit. So this could be hyper or hypothermia. That indicates sepsis, either way. And pulse more than 90, respiration more than 20, white PC more than 12,000, or less than 4,000. So if you have, those are the criteria. That's called SIRS criteria, systemic inflammatory response syndrome. If you have all of these four, that's a sepsis. Period. Okay. That's also an interesting case. I haven't seen this.
I know.
Huh?
Sepsis, septic shock, right?
Yeah, septic shock, yeah. Yeah, so now I have this guy. I haven't seen this question being asked, but I'm just going to throw it at you. So if you are a 25-year-old male who presented with a mass in your mouth, that's what I mean, not mouth, mass in your mouth, and you had the lump for many years. When I examined you, I found 2 by 2 cm located on the hard palate of the mouth that is immobile and has a bony consistency. What is that?
So a patient is 25, so he's young, right? Mass in the mouth, on the hard palate. If you give me multiple choice, I can tell you. I think they said it's something that is a benign growth, right?
Yeah, it's called teres palatinus. The treatment for that is nothing unless it is affecting speech or causing difficulty with eating, then you just take it out.
Okay.
Okay, now if you are a 23-year-old woman who want to fix your nose, okay, so you went, did nasoplasty, and then when I examined you 4 weeks after, I found whistling noise during respiration. Okay, so what do you think is going on here?
Is it septal perforation?
Yeah, septal perforation. This is very straightforward, easy question. Now, if you are a 39-year-old woman who present with pins and needles sensation for the past 2-3 weeks, when I check your calcium, I found it 6.5. I check your phosphorus, I found it 5.8. Wow! What's going on over here? So what's going on here? That's all what you need.
Okay, 39-year-old, pins and needles for 2 to 3 weeks.
Mm-hmm.
Okay. Calcium is 6.5.
Mm-hmm.
And phos is high.
Mm-hmm.
Okay. A lot of things can cause this. You know, if we have the PTH, maybe I can know more. But with this, I'm thinking maybe like a hold on.
So if I give you that
surgery,
if I give you these values of calcium and phosphorus, what do you think is the PTH level? Is it high or low? What is it?
PTH is gonna be high.
No, it's gonna be low, because the PTH the PTH. Remember this thing. You will never forget. I learned it from Dr. Najib, and I still remember it. It's called PTH. The other name for it, phosphate thrashing hormone. Okay, it trickles the phosphate out. So when you have the phosphate high in the blood, that means there's low PTH. And what support that is
okay,
there's no
if
calcium.
you have what? Phosphate high?
Yeah, in the blood, that means PTH is not working.
Oh, really? Okay, because PTH is not trashing the phosphate. Okay.
Yeah. So this is hypoparathyroidism. Can be caused by Wilson disease, neck radiation, hemochromatosis, defective calcium receptors, congenital, DiGeorge syndrome can cause that. Autoimmune, can be post-surgical, whatever. But that's these other risk factors. So this is what they clue with the USMLE. Labs and physical exam never lie, but the history lie a lot. Okay, and so there's a lot of overlap. But with the labs and physical exam, never overlap, and they have to give you a clue. Now, if you are a 56 white male who presented with a massive hematoma and brought to the emergency room by a friend who says that this has never happened before, and you have a peptic ulcer disease and esophageal varices secondary to alcoholic cirrhosis. So what should I do right now?
Okay, the patient has massive hemoptysis or hematoma?
Hematemesis.
Hematemesis, okay. And then what else?
Yeah, now he's in the front of you right now. He's vomiting blood. What should you do?
You want to do the ABC intubate, because you don't want the patient to aspirate on the.
After that, what else?
So then after you intubate, then you do the EGD, right? To go and see where the bleeding is coming from.
Before the EGD, you want to make sure you have an IV access.
Yeah, that's what I said, ABC and then intubate.
Yeah, intubate, and then IV access, 2 large bore.
Airway, breathing, circulation.
Yeah. So if you are a 67-year-old male who presented with nausea, vomiting, and increased abdominal pain for the past 3 hours. Okay, when I check your labs, I found the bicarbonate 14. Amylase is 300.
Your what?
You have vomiting, abdominal pain, bloody stool, okay? And you are a 67. You have all of these good stuff: diabetes, hypertension, you name it, everything. But now you had a different problem, okay? You had nausea, vomiting, abdominal pain, bleeding, bloody bowel, and then the bicarbonate is 14. That's all what you need. What do you think?
bicarb is 14. So bleeding, bloody bowel. Okay, coming from the lower. I think they said you go to do EGD first, go through the mouth and see. Either you do NG tube and then do EGD to see if the blood is coming from upper, and then if the NG tube or whatever is negative, then now you can do a colonoscopy, right?
But what's your diagnosis?
What is my diagnosis?
Yeah, this is called acute mesenteric ischemia.
Oh.
So this is different.
Acute mesenteric is.
Yeah. So the chronic mesenteric ischemia present with a pain after you eat food. But
you didn't say that. Okay.
No, that's
this is acute.
No, I'm not saying about this
acute.
case. No, just hold on, just 1 second. So the chronic mesenteric ischemia present with pain after bowel movement. Okay? But they don't have any lab abnormality. They just have abdominal discomfort. But the acute mesenteric ischemia is different. The patient have all of these risk factors, MI and all of these things, and they have emboli that goes and obstruct an artery, like just like a.
At least like you should have given us like AFib. The patient has AFib.
Yeah.
So that we would know.
Yeah, so it's just like an MI of the gut, like a mesenteric infarction. So the way they present with nausea, vomiting, and abdominal pain for the last 3 hours, and a bloody stool. And the bicarbonate will be low. That means there's a metabolic acidosis. So those are the clues for it, okay? And you have rapid onset of periumbilical pain, often severe. Pain out of proportion to physical exam. Okay, and then when you have hematochezia, that's a late presentation. That means the bowel has died. Okay?
Right.
On labs, you find leukocytosis, elevated amylase and phosphate, and metabolic acidosis. So that's a big clue. Metabolic acidosis, elevated lactate, that's a very big clue. So how do you diagnose it? You do CT angiography. Or mesenteric angiography. It's like a PE, you just do. So these infarction stuff are pretty serious, like stroke is infarction of the brain, a PE is infarction of the lung, MI. And then this is one, acute mesenteric ischemia, infarction of the gut. Acute limb ischemia, same thing. They have same risk factors, and the management have a lot of similarities.
Molly, can you tell me the big difference between acute and chronic mesenteric ischemia?
The bicarbonate of 14, that's a big difference. When you have bicarbonate of 14, that means the bicarbonate being consumed by the acidotic, by the lot of H in the blood. Okay, so that's the biggest clue that you would know that. And the blood in the stool too. This means that there is necrosis. So those are the biggest two. But most of the time, the questions that I did, it was the bicarbonate and the acidosis, or they give you pH is low. When they give you acidotic picture, leukocytosis, that's most likely to be an acute mesenteric ischemia rather than a chronic. Okay?
All right.
Okay, so if you are a 46-year-old male who have right upper quadrant pain, okay, on the 5th day after you're being hospitalized for pneumothorax fracture, brain contusion, and skull fracture. So what was your diagnosis? So this is like patient got admitted for multiple fractures. Okay, on the 5th day of hospitalization, he had right upper quadrant pain. So what do we call this? You did ultrasound, you found a small amount of pericholestatic fluid.
Acalculous cholecystitis.
Yeah, excellent. Acalculous cholecystitis. And do you know how to treat that?
Yeah, they do cholecystectomy, something that you puncture the. Yeah, you don't remove the gallbladder. You put a little hole in there. What do you call that again? Something otomy, not cystectomy.
Yeah.
And then it slowly drains.
Yeah, good job. Yeah. So this you give them
What do you call it again? What is the name? I can't pronounce it.
pericutaneous cholecystostomy
Cystostomy.
and antibiotics too. Okay.
Yes.
Now, if you are a 65-year-old Caucasian male who had a cabbage, unfortunately, due to an MI or whatever.
Sorry. How old?
65.
Mm-hmm.
You had a cabbage. On the post-operative day 2, you developed jaundice. Your total bilirubin is 9.2. Alkaline phosphatase is 300. Everything else is normal, like liver function test, PT, PTT, everything is fine. So what's going on with you right now?
So 2 days post cabbage with jaundice and so is it like a obstruction, biliary obstruction somewhere?
No, this is a condition. It's called post-op cholestasis.
Oh, okay.
Because Gabber is pretty tired after his cabbage surgery. So he said, "Oh man, I'm tired. I can't conjugate bilirubin and stuff." So you will have
Post-op cholestasis.
yeah. So this is you find it with the bilirubin will be high and the alkaline phosphatase will be high. It's mostly due to increase the pigment load and stuff. Okay, so if you are a 63-year-old male who presented with severe diffuse, you have abdominal pain that is severe and diffuse and constant. You're taking digoxin and warfarin.
Hold on. Abdominal pain that is severe and diffuse. Okay, and then?
Yeah, I do x-ray, I found air under diaphragm. Okay.
Oh, okay.
Your medication is lisinopril, digoxin, warfarin. So I ordered labs. I found the platelet is 90,000 and the INR is 2.1. So what should you do right now?
If there's air under the diaphragm, that's perforation. You need to take the patient to the OR.
Before that, what do you do?
Oh, the platelet is how much? 90,000?
And the INR is 2.1.
Oh, okay. Yeah, you do what do you call it? Fresh frozen plasma to correct so that the patient will not bleed. You do fresh frozen plasma and then you take to the OR.
Excellent. You don't want to take him to the OR and he's over anticoagulated. His INR is high and he's at high risk of bleeding. So the first thing you give him fresh frozen plasma. Okay, and then you take him to the OR. Okay, if you are a healthy 35-year-old male presented with abdominal pain for the last 4 hours, the pain started in the periumbilical but now shifted to the right lower quadrant, what should you do right now? Even if I don't give you that the white BC 16,000 and everything else is. Yeah,
so let's say this is a appendicitis. It's a clinical diagnosis, so you don't need imaging. You need to just take the patient to the OR.
Yeah, laparoscopic appendectomy.
Yeah.
Yeah, this is easy case. The diagnosis of while you're sleeping. That's an easy one. Okay, so now if you are a 24-year-old male who presented with a week of abdominal pain that localized to the right lower quadrant and exacerbated by motion, when I examine you, listen carefully to this sentence. When they say passive extension of the right hip with the patient on the left lateral decubitus position elicits significant abdominal pain. Boom. What's your diagnosis? And you had a right lower quadrant abdominal pain that's been going on for a week. Okay, and now you have this physical exam finding. So what's going on here?
So I think it's abscess, appendicular abscess, and you need to treat first before then you take the patient to the OR. So you need to treat with IV fluid, antibiotics, all of that,
Yeah,
and then later on
you
you can do appendectomy.
So how do you treat that? Like you give IV antibiotic, bowel rest, what else?
because it's I think, do you do incision and drainage? I don't know. As drainage? I don't
Yeah,
remember.
obviously, or any abscess, you just
Okay.
drain it first, and then
Mhm.
when do you do the appendectomy then?
Okay.
When?
You said, when do you do the appendectomy?
Yeah.
Oh, I don't remember exactly what time, but I think it's gonna be like weeks after that.
6 to 8 weeks after that.
6 to 8 weeks. Okay. Yeah, weeks.
Okay, yeah. So now, if you are a 42-year-old woman with a diffuse abdominal discomfort 4 days after undergoing an elective cholecystectomy. Okay? Now, on physical exam, you have distended tympanic abdomen with decreased bowel sounds, and there is mild diffuse tenderness. Okay? And you've been preoperatively, you had a morphine. So what's your diagnosis?
Ileus, paralytic ileus.
Yeah, that's Elias because of the morphine. That's why. Cause nausea, vomiting, distension, hypoactive bowel sound.
I had that on my CS.
Constipation, huh? Really, you had that at CS?
Yeah, I was like, what?
Really? Wow.
Yeah, that was very weird case.
That's interesting. You did it in Houston, right?
No, I did mine in Atlanta.
Atlanta. Nice. Okay. So yeah, Elias. So now, if you are a 29-year-old male who has vomiting, abdominal pain that's getting worse, and now you have this hyperactive bowel sounds, percussion reveal tympany, and the patient is diffusely tender to palpation. So what's your diagnosis?
So patient has something going on, maybe obstruction.
Yeah, small bowel obstruction.
Yeah.
Yeah, that's what it is. So if you are a 42-year-old male who hit a car from behind on the highway, now you have X-ray shows 8th left rib with a fracture without pneumothorax or pleural effusion.
Sorry, the X-ray showed what?
A fracture of the 8th rib without pneumothorax.
Okay.
8 hours later, he complained of left upper quadrant abdominal pain, left shoulder pain, mild nausea. I think by just giving you that, you gotta be able to know what's diagnosis. But I'll give you the blood pressure is 90/60, heart rate is 100. So
You're talking about spleen. Yeah, splenic rupture.
So what do you do best next step?
Splenic rupture, of course, you're gonna do ABC and then, take to the OR for, see if you want to repair or if you want to, how you want to fix it.
Yeah.
But you're taking the patient to the OR for lab.
Yeah.
Surgical exploration, yeah.
Yeah, first you do like abdominal CT with IV contrast, and then if there's a persistent hemodynamic instability, despite your intervention, they just take him to the OR, urgent laparotomy. You try to keep discipline as much as you can. If you can.
So you have to do imaging first before you take the patient to OR. Is that what you're saying?
Yeah.
Really?
Yeah. Unless the patient is hemodynamically unstable and persistent instability.
Yeah, but 90/60 is unstable.
Yeah, but first you give him IV fluid and stuff, maybe he will get better. But if he continues to be unstable, like for some time, then you take him to the OR. Okay? So now, this is very good case and a tough. This is very tough case and interesting at the same time. They can trick you on it. If you are a 34-year-old male who was involved in a high-speed highway motor vehicle accident, and now on physical examination you have multiple bruises over the entire chest as well as subcutaneous emphysema. Few hours later, your chest X-ray shows accumulation of air in the pleural space as well as pneumomediastinum. So what's going on over here?
Bronchial rupture.
Good job. Yeah, it's a bronchial rupture. Okay, let me just put my headphones on. Okay, so if you have an air under diaphragm, what should I do right now?
If you have what?
Air under diaphragm?
Yeah.
Just surgical
Maybe.
evaluation immediately because this is
Right.
Okay. Now, if you are a 42-year-old woman with a blood pressure 70/20, low JVD, an abdominal exam shows distended abdomen, absent bowel sounds, and some bruising.
Sorry. I'm sorry to take you back. He said the blood pressure is what?
Is 70/20.
Okay. And then JVD is what?
Is low, like obviously.
Low.
Yeah. So now,
Okay.
yeah. So this means it's not a tamponade or something. So now this means like losing blood, but you have abdominal pain. So I give you IV fluid, I intubate you and give you IV fluid. The blood pressure now 80/30. So what should I do right now?
Yeah, that means patient is unstable. Right? Hemodynamically unstable, so surgical.
Excellent, yeah, immediate exploratory laboratory. Okay, now if you have ruptured abdominal aortic aneurysm, the way that it
If you have what? Your phone is breaking in and out.
It's in laptop.
Okay.
Yeah, okay. So if you are a 62-year-old male who have diffuse abdominal tenderness and CT scan shows abdominal aortic rupture, what should you do right now?
Yeah, if it's rupture, you take to the OR.
Yeah, I just take them to the OR. Yeah. They did the CT scan. So now this is a good case. So if you're a 31-year-old biker, you had a direct blow to the lower abdomen and pelvis during the accident, and you also had a diffuse abdominal pain that referred to your left shoulder. So what part of the bladder is injured here?
Oh, I hate that. So let me see if I can make sense of it. So if you have a left shoulder pain, that means something is ruptured. You have peritonitis and radiation to the shoulder. So bladder. So give us again, what is it like? What type of bladder is it? Can you say it like give 3 choices?
So the bladder, we have bladder neck, bladder wall, anterior wall, bladder dome. Which one?
Bladder neck, bladder wall, bladder dome. Yeah, all those things.
Yeah, so if you have injury.
Is it bladder wall? I don't.
It's a bladder.
I know something
bladder,
that is gonna leak urine out, right? Something
yeah, so it's the bladder dome. Okay, this is called.
Dome. Okay. Okay.
So this goes to the peritoneum and causes peritonitis and irritation of diaphragm. What do you call this? What sign? Left shoulder pain. This is called Kehr sign.
Mhm.
Okay, it can happen.
So you said it's bladder dome.
Yeah.
Okay.
Because the anterior bladder wall and bladder neck is the extraperitoneal. The only one intraperitoneal is the bladder dome.
Okay.
Okay, if you are a 28-year-old male who had fever 102, neck movement, especially neck extension, are restricted due to the pain. So what's going on here?
neck, neck.
Hmm?
You say fever and neck.
Restricted neck extension, yeah.
And meningitis.
So in meningitis, restricted neck flexion. But we have restricted...
Oh, this is neck extension.
This is retropharyngeal abscess.
What?
Retropharyngeal...
Oh, pharyngeal, retropharyngeal.
Yeah.
In a 28-year-old male?
Yeah.
Really?
Yeah.
I thought they say mostly it's going to be like in children for retropharyngeal abscess.
No, it can occur in male, 28-year-old male too.
Okay.
So the treatment is just broad spectrum antibiotic and just drainage.
Okay.
Okay. Now, if you are a 27-year-old basket player, you block a shot with your right hand.
You what?
You block a shot in your right arm, like while you're playing, you injured your right shoulder. Now on physical, that doesn't matter. Okay. Now what matters in the physical exam, you resist internal rotation of your right arm. Okay, and you hold your right arm in slight external rotation, supporting it with your weight with your left hand. So what nerve is injured here?
Oh, axillary.
Why?
Is it not anterior shoulder dislocation?
Yeah, good job. Yeah, it's when you have forceful abduction and external rotation, and the right arm causes anterior dislocation of the humeral head. This causes axillary nerve injury. Now, if you are a 35-year-old male who have muscle weakness, sensory loss on your upper extremities, on physical exam you have moderate wasting of the small hand muscles and impaired pain and temperature sensation in the bilateral upper extremities. So
of your what?
In the bilateral upper extremities. No sensation in bilateral upper extremity. That's all. You don't need anything else. Which one? What's your diagnosis?
Sensation of the... Do you mind? Can you repeat that question again? I didn't get it clear.
Yeah, so when you have impaired pain and temperature sensation in bilateral upper extremities.
Oh, you're talking about
but the light
syringomyelia.
Syringomyelia. Yeah, but the vibration and light touch is fine. Only pain and temperature. This is syringomyelia. Okay. White injury. Okay, now if you are
1 second. Trying to get. Trying to get 1 second.
Okay.
Okay, go ahead.
Look, if you are a 43-year-old male who complain of pain and weakness after falling on outstretched hand 2 days ago. Okay, when I passively abduct both arms above the head and then ask you to bring them down slowly in abduction position, your right arm drops rapidly at the midpoint of descent. What's your diagnosis? What's going on here?
Is it rotator cuff tear?
Yeah, it's tear. Good job. Now, if you're a 29-year-old woman who have circumferential full thickness burn below your right elbow, when I examine you, I found circumferential scar over the right arm and your right.
You found what?
Circumferential scar.
Okay.
On the right arm, and the right radial pulse is faint, and your right hand is swollen. So how can I treat that?
Is it escharotomy?
Yeah, good job. To relieve the constriction. Yeah.
What's it called? The escharotomy.
Okay. Now, if you are a 46-year-old male, on the second day after upper abdominal hernia repair, you developed on physical exam decreased breath sound on the right lung base without wheezes or prolonged expiration. Heart sound is normal. There is abdominal distension and diffuse tenderness without rebound. Okay, your ABG, the pH is 7.4, PO2 is 70, PCO2 is 27.
You're too fast.
Yeah,
I'm trying
yeah.
to my brain to process it. Okay. It says second day after hernia.
Yeah, so second day after hernia repair, he had
Okay.
decreased
Decreased
breath
bowel
sound,
sounds.
decreased breath sound at the right lung base.
Oh, right lung base. Okay.
Yeah, and the PO2 is 70, which is low hypoxia.
Okay. PO2 is 70. Okay.
Yeah, and PCO2 is 27. So there's hyperventilation with hypoxia. So what's your diagnosis?
I don't know. So second day after hernia.
Okay, so we did chest x-ray to see that. Chest x-ray shows dense opacity at the right lung base.
Oh, okay. So chest X-ray showed patchy. What?
Dense opacity at the right lung base, and
Okay.
this is part of the post-operative pulmonary complication.
Is it a pulmonary contusion? I don't know. Or ARDS?
No,
Either one of them.
contusion when you have a trauma, but this one operation, after operation.
Okay.
So this is called atelectasis.
Oh, atelectasis.
Well,
Okay.
that's how it does that. How does it present that?
Okay. Okay. Okay.
Okay, if you are a 65-year-old male who present to the ER with increasing shortness of breath, fever, productive cough.
Sorry. Just need to turn off my phone. All right. Sorry. Go ahead.
Okay, you're a 65-year-old male. You had a motor vehicle accident. After that, you had a deep absent breath sound on the right side and distended neck vein with hemodynamic instability. So how can I fix that?
Okay. So decreased breath sound on the right, increased JVP, and what?
No, not decreased. Absent breath sound on the right side.
Oh, okay, absent. Okay.
Undistended JVP. What is that?
You thinking about pneumothorax?
Yeah, so you give a needle for a thoracostomy.
Yeah, you do thoracostomy.
Okay, if you are a 34-year-old immigrant male from Mexico who present to the ER after coughing up foamy sputum with a significant amount of bright red blood. Your breath sounds are audible bilaterally with some expiratory wheezes on the right side. Portable chest X-ray shows dense opacity in the right upper lobe.
Mm-hmm.
Okay, so what's your diagnosis and what's
TB.
Yeah, so we gotta do respiratory isolation.
Mm-hmm.
So this is the thing. Now, if you are a 55-year-old male who present with a blood pressure of 90/60, pulse is 110, physical exam shows altered sensorium, crackles at the right lung base, and the
Physical exam showed what? Altered sensorium.
Yeah, crackles at the
Okay.
right lung base and well-healing abdominal wound. Your blood pressure.
Well healing.
Yeah. Your blood pressure is 90/60, pulse is 110, and temperature is 104. So what is best next step that I should do right now?
You say well healing wound from what? What did the patient have the wound from?
Previous surgery, like abdominal surgery. But even like this, if you just focus on the fever, hypotension, tachycardia. So what's best thing to do? That you just give him IV fluid. This is septic shock. They meet the search criteria. That's the question. Search criteria. like pulse more than 90, which is blood pressure is low, and temperature high grade fever. That's most likely sepsis, and white PC is high too. So we just give him IV fluid first and then antibiotics. Okay, now this is a good case. Now, if you are a 53-year-old male who had a motor vehicle accident, okay, after the motor vehicle accident, your chest X-ray showing alveolar opacities over the right and lower lobes.
Shows what?
Alveolar opacities over the right and lower lobes. And you complain of continued chest pain and shortness of breath. So what's most likely responsible for shortness of breath here?
I don't know if I can answer this with the information you have given to me.
Yeah. So when after motor vehicle accident, when you see chest X-ray showing alveolar opacities over the right and lower lobe with a normal temperature, that's most likely pulmonary contusion. Okay.
Okay.
That's how you know. Other features, they may give you that the PO2 is low, 60, 76.
Yeah, I was looking for that hypoxia and
Yeah, maybe I should have given you that. Yeah, I'm trying to make it harder for you, but you're able.
Come on.
Yeah, but
USML is not gonna do that. It will give you more clues.
Yeah, but that's good that you know it from small amount of clues, so that's mean you're gonna do well on the exam. Okay, another case. So if you are a 12-year-old boy with a PO2 of so you had a motor vehicle accident, and then when you presented to the ER, PO2 is 60, and the X-ray shows patchy, irregular, alveolar, and filtrate on the right, middle, and lower lobe.
Yeah, pulmonary contusion.
Excellent, yeah, pulmonary contusion again. Now, if you are a 67-year-old male who have we made an abdominal aortic aneurysm repair. We did that surgery on you, and now you presented with you didn't have any cough, shortness of breath, or chest pain. So you had an abdominal aortic aneurysm repair. So what is the best measure to prevent post-operative pneumonia?
Incentive spirometry, or lung breathing exercise.
Yeah, incentive spirometry, deep breathing exercise, and continuous positive airway pressure too. Okay. Now, so if after a motor vehicle accident you presented with a blood pressure of 70/30, heart rate of 120. So what type of shock is that with normal temperature?
Normal temperature, blood pressure is 170/30.
Yeah, 70/30, and heart rate is 120. So what type of shock is that?
Hemorrhagic shock.
Yeah, hypovolemic, like loss of intravascular volume.
Yeah, hypovolemic, yeah.
Okay, so now, if you are a 24-year-old male who had a severe back pain and some abdominal discomfort after a motor vehicle accident, when I examined you, I found weakness and decreased pain on both legs. And the proprioception sensation is preserved. So what should I do right now?
Okay, 24-year-old male with back pain.
Yeah, and on exam you have weakness and decreased sensation over both legs, but proprioception is preserved. This after a motor vehicle accident. So what should I do right now?
Or is it cord injury? I don't know.
What is it?
Say like spinal cord injury.
Excellent. Yeah, that's it. Good job. Yeah.
Okay.
So this is where you
I
have
was
the
like,
anterior part of the spinal cord. So the best thing, yeah, good job. So this is, yeah. So the best thing you want to do here, you want to do bladder catheterization.
okay, to check for urethral injury.
Yeah, and because he's not able to control his bladder anymore.
Okay.
Stop, yeah, can you imagine like this?
I know.
It's crazy.
That's
You
sad.
know, life sometimes is very tough. Okay. Now, if you are a 68-year-old male, we did the surgery for you for diverticulosis. Your blood pressure.
For what? Surgery for?
We did colonic resection for diverticulosis.
Oh, diverticulitis. Okay.
Okay, blood pressure is 110/70, and heart rate is 90. Your white blood cell count is 13,000. Okay. So, what do you want to do right now for this patient?
So patient already had surgery for diverticulitis?
Yeah. But after 24 hours, he presented with that condition. With the blood pressure of 110/70, heart rate of 90, and the indwelling urinary catheter shows no residual urine in the bladder.
Oh, no residual urine in the bladder. Okay. So if there's no residual urine in the bladder, you want to do IV, bolus of IV fluid.
Good job, yeah, bolus of IV fluid, because this patient is going, those are the signs of dehydration. Blood pressure is low, heart rate is high, no residual urine. So this code also oliguria. They have also creatinine high, but you're good job that you found it. I could have given you more clues, but you found it from those clues. Good job. So they have creatinine high, another clue, and the urine will be less than 400 cc, and less than on the B1 over creatinine more than 36 around. Those are the signs of oliguria. So you give them bolus of IV fluid. That's treatment. Now, if you are a 21-year-old female with a hairline fracture on the shaft of the second metatarsal, how can I?
Hairline fracture?
Yeah, on the second metatarsal. So what should I do right now?
Of second metatarsal?
Yeah.
Yeah, his hairline is not completely broken, so reassurance, observe.
Give him analgesia, rest and analgesia, give her.
Yeah, some pain medication, right? Yeah.
Surgical evaluation only if it's a stress fracture in the fifth metatarsal or displaced fracture not amenable to closed reduction. Then you give surgical intervention. Okay, now if you are a 39-year-old 39-year-old guy with a right-sided hip pain that makes it very difficult for you to lie on your right side while sleeping. Okay, the pain localizes to the outer surface of the thigh. What's your diagnosis?
The pain localizes to where?
To the outer surface of the thigh.
Okay, so pain on right hip pain, right?
Yeah, so the hip pain, there are three types. Okay, there are one that's in the anterior. That's an osteoarthritis pain. Anterior hip pain, that's osteoarthritis. Okay, and there's one in the lateral, and there's one in the posterior. Posterior hip pain, most likely sciatica. Anterior, osteoarthritis. But the lateral, what is the lateral hip pain?
Is it I'm 39-year-old. I'm thinking about what is it? Is it like a bursitis? Is that what you're trying to say?
It's a trochanteric bursitis.
Yeah, trochanteric bursitis. Yeah.
That's it. Now, if you are a 34-year-old male, on exam I found numbness of the left wrist and marked limitation of extension of the wrist. What nerve?
Of the what? Numbness of the
Yeah, weak extension of the wrist. That's it.
Weak extension of the what?
Of the wrist.
Rest?
Yeah.
What is rest?
Wrist, like.
Oh, wrist. Oh, sorry. Numbness and weak extension of the wrist. Okay, please repeat the whole thing again if you don't mind.
This is, I think you know that. This is radial nerve injury. They have weak extension of the wrist.
Okay.
It's a very simple question. Yeah. I was about not to ask it actually because I tried to ask like tricky ones. So let's do a rapid review. This is the end of first part of surgery. So let's do a rapid review of the rapid. Okay, so now the abdominal aortic aneurysm rupture present with the back pain and hypotension. If you have bilateral atherosclerosis, that's most likely you have impotence, Larish syndrome. If you fall from the third floor with mild mediastinum, that's most likely aortic injury. If you have distended JVD resistant to IV fluid, that's a tamponade. If you have early diastolic murmur with wide mediastinum, that's most likely dissection. Okay, if you have catheterization and you developed abdominal pain, that's most likely retroperitoneal hematoma. If you have a heart rate of 120, a blood pressure of 90, and with leukocytosis, that's most likely bacterial infection. If you have a mass on your palate, that's most likely called teres palatinus, it's congenital infection. If you do rhinoplasty, you may have nasal septal perforation. If you have high phosphate, low calcium, that's a hypothyroidism. If you have hematemesis, you gotta have an IV fluid, too large IV fluid. Now, if you are a 67-year-old guy with vomiting and abdominal pain with hematochezia with low bicarbonate, that's acute mesenteric ischemia. Now, if you have a post-operative or like after you critically have multiple fractures with third post-operative day or the fifth one, you had a right upper quadrant pain, that's a calculus cholecystitis. You treat it with drainage. Because obviously there's no stone, you just drain the stasis, calculus. Now, if you have a post-operative right upper quadrant pain, that's the post-operative cholestasis. Okay, not necessarily right upper quadrant pain. You may just only have jaundice and elevated bilirubin. Now, if you have air under diaphragm with INR of 2, you gotta do fresh frozen plasma before we take you to OR. Now, if you have right lower quadrant pain, that's appendectomy. But if we don't do appendectomy after a week, and you have hip pain that works with hip movement, that's most likely abscess. Morphine can cause hypoactive bowel sound with distended abdomen, which is ileus. But if you have hyperactive bowel sounds and distended abdomen, then most likely small bowel obstruction due to appendectomy that you had 6 months ago, to adhesion. Now, if you have left upper quadrant pain, that's a splenic injury. If the chest X-ray shows air in the pleural space as well as pneumodiastrum, that's a bronchial rupture. Okay, if you have air in the diaphragm, that's surgery. If you have distended abdomen with absent bowel sounds and hemodynamic instability, then we gotta take you, that's resistant to IV fluid, we take you to OR too. If you have injury to the bladder dome, then this may cause Caher sign, which is abdominal pain plus shoulder pain that refer to shoulder, left shoulder. If you have fever with a neck pain that works with extension, neck extension, that's most likely to pharyngeal abscess. If you have, if you're a basketball player who tried to stop the ball and you had excessive forceful abduction and external rotation, that predisposed to anterior shoulder dislocation, which causes axillary nerve injury. If you have loss of bilateral upper extremity of pain and temperature, that's most likely syringomyelia. Can progress to motor like if it's severe. If your right arm drop rapidly at the midpoint of the descent, that's a rotator tear. If you have decreased blood, a few radial pulses with an scar, then you gotta do a sclerotomy. If you have opacities in the lung postoperatively, that's most likely atelectasis. If you have absent breath sound in the lung, that's you gotta do needle, that's an intention pneumonia. If you have dense opacity in the right upper lobe with fever, it's most likely TB. Okay. If you have an irregular alveolar infiltrate in the right middle and lower lobe after trauma, that's most likely pulmonary contusion, especially if there's hypoxia. The best way to prevent post-op pneumonia is by excessive spirometry, deep breathing exercises, and positive pressure ventilation. Okay, if you have decreased weakness and decreased pain in both legs after trauma, we gotta do bladder catheterization for you. If you are a 68-year-old male with oliguria by having creatinine is high and dehydration sign, we gotta do bolus IV flow. If you have a hairline fracture at the shaft of the second metatarsal, then we do rest and analgesia. If you have lateral hip pain, that's trochanteric bursitis.
Okay, question. On the hip pain, you said that the anterior is osteo?
Yeah.
And then lateral is trochanteric. What is the posterior again?
Sciatica can cause nerve.
Oh, sciatica. Okay.
Okay, so that's the end of the first part of surgery. Let's take a 5-10 minutes rest, and then we'll continue the second part of surgery and the last one, okay?